Good afternoon and welcome to Good Samaritan Facebook Live. My name is Adam Thacker. I'm the Chief Operating Officer here at Good Samaritan. Today I have joining me one of our newest physicians, Dr. Vetta Higgs, who specializes in hematology and oncology.
Right.
Been with us since February?
March.
Yeah. March. I was thinking late February, so since March.
Right.
So why don't you start off, tell us a little bit about yourself,
Okay.
your training and background, and what brought you to
Okay.
Vincennes, Indiana.
Yeah, I actually grew up in the Gulf Coast, so I was fortunate that I got to go to medical school in my hometown of Mobile, and so I was able to really have a lot of support, from family at that time. Then went to North Carolina where I did my fellowship training at Wake Forest School of Medicine. That was an excellent, comprehensive cancer program that really, I feel, it prepared us to go out into the world and kind of do well as far as taking care of patients who have cancer. What brought me to Vincennes was really the opportunity. I felt like it was a good program. I also have a friend that, had taken a job in another part of Indiana that had that affiliation with Indiana University. So that was kind of the impetus for me to look at this program. And, I think it's been great. The community has been very welcoming to me, and, I'm excited about being here too.
Excellent. Well, in your everyday practice, why don't we start off by talking a little bit about what oncology, hematology is, the types of patients that you see.
Okay. Normally, a hematology oncology physician is going to be a person that takes care basically of patients who have cancer. Usually, we get a lot of our referrals from primary care physicians and surgeons, so that's kind of how the process normally will start, with patients being referred to our clinic, for evaluation. We also, will look at patients who have blood disorders like anemia, low platelets, and so that's really how the process usually starts for those patients.
Excellent. I think cancer, oncology, very well-known words, regardless of medical training. Most all of us in our lives have been impacted directly or indirectly in knowing somebody that has had cancer. Hematology, a little bit less so that we see that, but certainly anemia and blood disorders are a big part of your practice. And as you mentioned, putting the plug in for kind of the whole medical team, a lot of what you do starts with our patients having a primary care physician or a surgeon that it may be a biopsy, a removal of a lump, some sort that then leads to, okay, we need to take some further action. So maybe speak a little bit in your practice, so from a medical oncology, hematology standpoint, but we have a cancer center with many other services that you kind of coordinate as the quarterback of that, so to speak.
Exactly. Yeah, so normally when a patient gets referred, a lot of times you may end up seeing the medical oncologist who really is going to be responsible for talking about options from a chemotherapy standpoint. And then you also may potentially see a radiation oncology. So usually we're going to work in concert with each other. Normally when we see those patients, our goal is really to give you definitely good information about what's going to be the best option from a treatment standpoint for you. We also want to give you some of those statistics about benefits of treatment, risks for treatment, and we're going to look at you just, on the whole to try to come up with what we feel is going to be the best option for therapy. And again, if you're meeting with the radiation doctor, there's always going to be that communication with the medical oncologist and the radiation doctor about, how we coordinate those treatments if that's felt to be necessary.
Sure.
So.
And And certainly any of your patients that are facing a new diagnosis of cancer, that can be very scary, and there's a lot of elements to that. I trained a very large organization in Wake Forest, and had great training background. As you came here, you mentioned our infusion center, our radiation oncology, and for the most part, your patients, as you start that treatment plan, can receive all of their care here locally, without having to leave the organization. And it's not just about that from a Good Samaritan standpoint, but as I'm sure you see many times with cancer patients, having their family around and that healing environment.
Exactly. Yeah, all of that is important, and that's also one of the big advantages to being here, because it's a great hospital, in a small community, and the fact that that investment was made to allow patients, to have that specialized care, so they don't feel that it's necessary for them to go out into other areas. Also the good thing here is we do coordinate with the doctors at Indiana University, and one of the things I've noticed with them is that they have been very receptive and available to us. And also, if we need to facilitate referrals of patients, those doctors have generally been very receptive to that. The infusion center, the nurses, a lot of times they're on first name basis with those patients that come in. They make sure they're taken care of. They make sure that if there's any issues, they're notifying us about it. So, it definitely is. And also, we have a nurse navigator who works really closely with those patients. So a lot of times they may even contact her first, and she gets that information to us pretty quickly. Even from the radiation perspective, I know there's a linear accelerator that they have access to. I really like the palliative care program that we have here too. So, it's really just a comprehensive center, and pretty much we feel we're able to do a lot of things that they can do in even those bigger communities for the patients.
Yeah, that's great. And as we talk about that comprehensive center, we're accredited through the Commission on Cancer, and part of that is what helps us to stay at top-notch care and looking at resources. You mentioned the navigator, social services, pastoral care, all pieces that go around caring for patients that have cancer outside of just the diagnosis, starts that process, and then having all of those resources are really important.
Exactly.
One key element to education for our community from a cancer standpoint is not just that it starts at that diagnosis, but identifying early through detection, screening events. Maybe speak a little bit to Good Samaritan, what you've seen as you've come on board. Granted, it's been for a few months,
I know.
So you're still getting acclimated to all of those, but how our Good Samaritan team kind of gets out in the community and there are screening potentials.
Yeah, definitely. I think the one takeaway I would tell you from this conversation we're having is screening is key, because a lot of times screening has enabled us to find cancers that, are early, which is what we want to do, because a lot of times when those cancers are found early, they're more treatable, patients are curable at that point. So that's really why we want to encourage that. We want to encourage you to do your mammograms on a regular basis, do your colonoscopies. We also know that in patients who smoke, some of the research has shown those patients should go through screening with CT scans. Definitely doing your pap smears, because that's one of the key components to detecting cervical cancer early. So one of the things we've seen here, like they have the breast care center here, they're really on the forefront of making sure our patients get the mammogram imaging done at those appropriate times, and then they notify and coordinate with us about, if a patient has an abnormal mammogram, they get them in to the surgeons pretty quickly. So it's really a big team effort. And definitely we do want to encourage people in the community to make sure they do their screening, because that's going to be the most important thing.
Right.
Yeah.
And screening events such as through our community health, farmers market. I know August 7th we have an event at farmers market, but there are many different screening events through community health, and then as well with primary care physicians doing annual wellness, and that includes getting annual labs, which can help to tell us, okay, is there something going on that may lead to a additional test to identify if there is something going on.
Yeah, and one of the things, like from a prevention standpoint, we know prevention is an action that's done, to lower the risk of cancer. I was fortunate when I was a fellow that I got to rotate through the National Cancer Institute, and I saw how some of those prevention trials were done. So the key takeaway, again, has always been screening. That's the most important weapon we have to kind of lower the risk of cancer. There are certain medications, like tamoxifen is one of the drugs that sometimes we will recommend to lower cancer risk. But again, the key component to lowering those cases is going to be for you to get your screening done.
Right. So that early protection, and you mentioned the different stages that cancer can be put into. So if somebody is diagnosed maybe stage 1 to stage 4, and something that you said that I think is sometimes a misnomer in the field of cancer is that early detection, cancer can be cured. It's not just a treated and you live with it for your life, but in cases where early detection really works, it's actually curable, rather than as you get further along, we're treating that, and it's going to be a lifelong event.
Yeah, because, we always will have the discussion with patients about what are the goals of care. That's something that most oncologists are going to have that discussion. So we know if it's an early stage cancer, our goal is going to be cure. If it's somebody that has more advanced cancer, our goal is going to be controlling that disease. So that's why, again, as you said, the importance of screening is there, because we do want to find those cancers when we can have those discussions that our goal for you is going to be cure.
Right.
Yeah.
And pivoting a little bit, as we look at today, we've seen some increase in our COVID transmission in the community. And one thing that was certainly impacted in the peak of our COVID pandemic was a lot of screening opportunities were actually delayed or even shut down for periods of time because of risk of bringing people together, and so those have been postponed. And now certainly as we want to continue to push that, but maybe talk a little bit about in your office, patients that are coming to your office or that in the future may need to come to your office, some of the safety measures that we're taking now that we're seeing a little bit of an increase in the community.
Yeah, COVID, I think, has had, it's had an impact really throughout everywhere. One of the things we've done, usually that you're going to get a call before the visit. They'll ask you certain screening questions to indicate if there's been any exposure. Are you having fevers? Have you had any testing done? And then, the office and the hospital are still requiring you to wear a mask, when you're in those facilities. And we understand it's difficult, but we definitely want patients to be safe, when they're coming here. And so that's one of the reasons why a lot of those measures are in place for you. But we still don't want you to delay, doing any of the things you need to do. And that's one of the good things here, too. The hospital is trying to make it a point to keep things operational, for those patients, because we still want to have where patients are able to get some of that testing done so they can, if there's something to be found, it's found early.
Right. Key element is early detection, and so that involves getting out there and
Right.
participating in screenings if you're in an age category that's recommended to be screened. All of those activities are going on. Everything continues to look a little bit different. Masking and the distancing aspects of keeping anyone entering our facilities safe. So
Right,
that's remains our top priority.
Right.
Anything else that you would like to discuss?
Well, I just want to say definitely I'm happy to be here. We want to be a resource for the community. We want you guys to know that any question is a good question, and one of the good things here, we feel like we do have that time to give to patients, where we are able to talk with them, talk with their families, and again, with a lot of the supportive aspects that we have, even if the doctor themselves can't talk with you, we've got, a good nursing staff, good navigators, good support people that are going to be there for you. So we want you to really understand and know that we're here as a resource for this community.
Excellent.
Okay.
Well, appreciate you taking the time
Thank you, Adam.
to
I
talk today
appreciate you.
and get a chance to meet some of the community through Facebook Live.
Yeah.
And just again, thank you.
I appreciate
All right.
it. Thank you.
I will see if we have any questions from our viewers. All right, no questions. That means
All
we were
right.
thorough. We covered
No,
it all.
let's hope. Thank
All
you.
right. Thank you, everyone.
All right. Thanks so much.